He wanted to castrate himself by pinching off the blood flow to his testicles. Surgeons, what's the weirdest object you've had to remove from someone's butt? MD, but not a surgeon. On my surgery we had to remove a mini Nerf football from someone's butt. He kept apologizing and saying he wasn't gay. Later, the attending surgeon told us that it's always the straight guys coming in with stuff up their butts and they always try explaining that they aren't gay. We received a patient with horrible pain that felt like constipation. He couldn't poop and laxatives weren't helping. We soon found out that the blockage wasn't just constipation, it was a string of beads several meters long that had become tangled into an ugly ball inside. I had to snip it apart and carefully pull pieces of it out. When most of it was out, his butthole became a rocket engine with diarrhea as the propellant. I once had a flatmate who was a nurse. She had a patient who came in complaining of stomach pains, which was caused by the cucumber he'd shoved up his butt a couple of days earlier. Apparently the smell caused by pickling a cucumber in your colon is extremely nasty. Dunno what qualifies as weird anymore. Between myself and friends. Glass vibrator, vibrating vibrator, travel toothbrush holder, Campbell soup can, cucumber, mag light, cologne bottle, Sean John unforgivable hay, time capsule, light bulb, aerosol can cap. The oddest one was literally nothing. Guy comes in complaining of something stuck up their butt by girlfriend. ER doctor feels and nothing there. X-ray and CT scan says maybe something there. I don't feel anything. In the operating room I feel deeper and still nothing. Finally do a full colonoscopy and nothing there. I'm not a doctor, but my cousin is a colorectal surgeon. She's dealt with at least 2 people who have put light bulbs in their butts. I'm in med school and have talked to a bunch of ER docs. We've determined that no one starts with a light bulb, they've just successfully retrieved every inanimate object prior. Girl I know had suspected cervical cancer. Saw 2 different doctors before a specialist examined her surrounded by trainee doctors, grabbed and pulled on what everyone thought was an inflamed, infected, tumorous cervix. It was a love egg. It had been in there for 3 months. Son of a doctor here. My dad removed an entire peeled sweet potato from someone's colon once. He swore that he had just slipped and fell on it. Maybe he was just cooking while naked, he peeled the potato, put it on the floor so he can get something from the fridge and whops, just slips and falls right on the potato. Not the butt, close to it. My sister worked in a urology clinic and has some very crazy stories ranging from at-home sex change procedures to this case in particular. She had to remove almost 200 BBs from a guy's bladder via his urethra one by one. As the guy had a fetish of shoving things down his urethra. Another man wanted to castrate himself by pinching off the blood flow to his testicles with the use of rubber bands. A guy legit researched the process of cutting off his penis and testicles and eventually built up the courage to take a scalpel and slice of his penis and almost got through the testes before he started going into shock. And his wife, who was completely unaware of him even wanting a sex change, found him on the floor bleeding out. When I worked in the ER we had a guy come in with a 6-battery mag light stuck up Main Street. The funny part is that it was inserted bulb out and it was turned on. So we laid him down prone and the doc spread his cheeks. The room lit up like he just cracked open Marcellus Wallace's briefcase. Back when I was an ER tech, we had this guy come in with a full-size bottle of VO5 shampoo up his butt. Of course he said he fell on it in the shower. You could clearly see it on the X-ray, it was pretty spectacular. The best part was he knew exactly what needed to be done to get it out, suggesting that this wasn't the first time. He asked for conscious sedation and for someone to pull it out. Well, the ED doctor tried that, then tried to manually get it out with forceps, and was essentially elbow deep in this dude. But couldn't get it. He had to go to the operating room to get it taken out. I bumped into the surgeon a few days later and asked him how it went. He joked to me that after we knocked him out, I grabbed a plunger out of the bathroom and got it out that way. But then told me all he had to do was stick some suction up there till he felt it connect, and then slowly pulled it out. According to the surgeon, this guy never presented any sort of identification or insurance card, and demanded to pay his entire bill before he left. Usually takes some time for bills to get finalized. He paid it completely in cash, and then left via a taxi. Not a surgeon, but as a former paramedic I brought them lots of business and feel qualified to chime in. I brought a guy to the hospital with severe abdominal pain and rectal bleeding. The dispatch nature was accidental injury, not life-threatening per patient. The chief complaint was I put something in my butt and can't get it out. Patient refused to elaborate on something. Delivered patient to the ED and was filling out my run report when the charge nurse came into the EMS room and said, "Come here, you have to see this." I followed her to the little X-ray alcove next to his room as a surgical orderly was wheeling him out of the room along with the nurse and the ED attending. The charge nurse flipped on the light board. Yes, I'm going old enough. X-rays used to be film-based, and I stared in confusion for a few seconds. I could make out the pelvis, both femurs, spine, etc., but there were other hard objects shown. She pulled down the first X-ray and put up the second, which is when I made out a small animal skull and I realized the other objects were bones as well. I looked over to the nurse and started, "Is that a rat?" She finished. Dude stuck a rat up his butt, and was rushed to surgery because it chewed the hell out of him, pun intended, before suffocating and had perforated his colon in multiple locations. He survived to discharge and is presumably still out there. My partner and I never did determine the method of administration, but I'm picturing one of those Habitrail plastic tube cage setup things. Not a surgeon, but a former anesthesia technician while in the Army. I had a few interesting cases come through. Top 5, not in order. Light bulb, not like a lamp light bulb, but one of those LED lightsaber bulbs that you see air traffic controller people using. 24-inch double-ended ribbed black sex toy. That was a guy who had it stuck there. Soda can. Ken doll. This was actually removed from a woman's vajayjay. Half a baguette. Not a clue how that happened, honestly. I've thought about it a lot and just never could figure it out. Had a friend in med school whose assignment was to figure out how his cadaver died. He found about $5 in quarters up the man's butt. Don't shove metal up your butt, metal poisoning is real. Not me, but a good friend I have known since 6th grade who is an emergency room drive. Straight couple in their early 20s and they were using a vibrator on her. They switch, he said it was his first time, and they had lube everywhere and the slim 6-inch vibrator disappeared all the way up in him while it was still on. They waited and tried to get it out on their own and finally went into the ER. They were going to wait till the batteries died, but it was getting late. My buddy tried to get it out but couldn't get it. He told the guy they might have to do surgery to get it. The guy asks my buddy if he has to go and can he call his mom and tell her. My buddy laughs and says, "You are 22 and you get to call your mom to tell her you have a buzzing vibrator in your butt that might be perforating your colon." Then my buddy remembers a guy who went to medical school who works in the same hospital. He has freaky long thin fingers like E.T., that might work. The other doctor gloves up and gets the vibrator still buzzing out of him. Just an FYI, it is really easy for this to happen, so limit the lube on your hands. Your colon gets like a suction on it and things go in easy, like what happened to these guys. From looking at the medical Reddits, I have learned that every type of object known to man has been placed inside of someone's anus somewhere at least once. We progress from sticking everything we see into our mouths as kids to sticking everything in our butt as adults apparently. Fun fact, the reason people end up in the ER with things stuck in their rectum despite the common correlation of poop coming out of that hole is because of a combination of factors. The rectum acts as a vacuum and sucks things in because of negative pressure, and the muscles in that area are designed mainly to keep things in, so we aren't perpetually pooping wherever we roam. ER nurse. I've seen baseballs, loads of vibrators, cans of soda, vegetables. There should be a public service announcement about using vibrators in the bum. It needs to have balls, or some sort of base so it doesn't get lost up there. Women's vaginal vibrators don't need them, as there is only so far it will go. A doctor I worked with once told a man, "It's okay if you want to put things in your rectum. You just have to use the right things." Enormous silicone butt plug which broke off at its base inside the patient. It was shaped like a soft cone on a stalk, with the base at the bottom. Had to remove it in pieces. Also, an Orangina bottle 2 years before this butt plug. Years ago my nurse wife told me a man had an apple removed from his butt, but I never understood how this could be possible. I often think about this but I've never asked her for more details. I'll ask her over the table at Christmas dinner tonight. Not a surgeon but a vet tech. We diagnosed a cat with pancreatitis, very dangerous, but the owner insisted the cat was constipated, because he hadn't had a BM in a few days. Hadn't had a BM because he hadn't eaten in a week, also very dangerous. We told her the cat needed to be hospitalized. She said she couldn't because she had a holiday in Cuba the day after. She gave our number to the poor pet sitter who called us begging to take this screaming cat off their hands. I drove to pick the cat up and one of the worst sounds carved into my dreams is being stuck in traffic with a wailing, dying cat. Get to the clinic and we find blood and something around his anus. Well, the cat died and we talked the owner over the phone and she starts sobbing asking how could this happen. Turned out before she left she read on the internet that egg yolk up the butt would cure constipation. Whatever she used had punctured through. I would happily beat 7 kinds of hells out of that ignorant old woman. Endotech here, had a guy come in with a capped section of PVC pipe filled with mercury because he liked the sloshing when he jerk in his turkin. Had to call in hazmat and security had to be called when he became violent because they wouldn't give the mercury-laden pipe back. Not a surgeon, but do I know a lot of cases involving falling on things and other such excuses. Here are just some of the things I know: a Buzz Lightyear action figure, a Barbie doll, plaster of Paris. They wanted a mold of his colon. Instead, it had to be cut open as it was glued shut by the plaster. Glasses, the sight kind, jewelry, mostly necklaces. A cucumber which, after proclaiming he fell over in the garden naked and landed on his cucumber patch, still had the Tesco wrapper on it. A light bulb. Finally, on a rather dark note, if you're a fool who slips something up their black hole, 'cause the butt sucks things in disturbingly well, they can't retrieve, please, for the love of God, go to your doctor. People have died due to toxic shock due to this stuff. A guy here died of it in 2 weeks due to having a dildo stuck up there and never went to his docs. Your pride can recover, but you can't recover from death. Not a surgeon, but a nurse here. One time around Christmas time, couple of police officer brought an inmate for possession of illegal drugs. We were confused why he is brought to the ER just for possession. Anyways, we ended finding out he an Easter egg full of meth in his rectum and they were trying to figure how to get it out without busting it. Well, it was the end of my shift so I never found out what happened. Honestly, I couldn't care less what happened to him. He was a butthole and treating us like crap, and at the end of 14 hours shift and being short staff, I was ready to get home. My friend said she lost a butt plug up there. Shouldn't be a big deal. First, I don't know how it's possible, but she claimed it was a little one, and given how upset she was telling the story after, I believe it. I just don't understand it. But said a dude had her tied up like a mummy using duct tape, and dude literally breaks character and says, "Do you remember if I put the butt plug in or took it out?" And long story short, they are both blitzed as hell, so have call a friend to drive them to the hospital to get it out. Except, she's embarrassed as hell and doesn't wanna go. So dude shows up and the dumb dude remembers, "Hey, aren't you a medical professional?" And guy is like, "Yeah," and they recruit random dude to fist her ass and recover it. And he does. But dude turns out to be a homeopath and has nothing to do with retrieving stuff from butts. She said then ended up double teaming her. I asked an obvious question, so double simultaneous anal? And she told me not to be gross. A friend of mine is a surgery resident, and during one of her trauma shifts a meth head walked in with an incandescent light bulb in his colon. It was shoved in with the wide part first. They were dilating the rectum in an attempt to remove it, and the resident in charge of the procedure managed to accidentally separate the metal base from the glass globe, which immediately shattered under the pressure of the colon. They had to perform a partial colectomy to resolve the complication. Meth is a hell of a drug. A foreign body per rectum is a fairly common occurrence. In my time rotating in the ER, the most common things have been yucca roots, avocados, shampoo bottles, etc. But that light bulb story is still unmatched. I wouldn't have believed it if I hadn't seen the X-ray. I was an RN at a busy Detroit emergency department. A homeless woman, frequent flyer and drug abuser, came in to see us with abdominal pain. The X-ray revealed 17 oval-shaped objects in her vaginal space. They were removed by a very diligent medical resident armed with a speculum and McGill forceps, with the aid of an ultrasound tech. 17 Barbie doll heads. Their removal was made a bit easier by their long hair. Somewhere out there in the world there is that one deeply unfortunate person who was actually cooking while naked, who did slip on the kitchen floor, and whose ass really did slam down on the freshly peeled potato. 1 in a million chance. Poor guy probably went to the ER figuring no one will ever believe me, and just told the attending physician, "I'm into some weird kinky tuber sex play." Not a surgeon, but I work in medical insurance, and we get these internal newsletter from some of our in-house doctors and clinical staff with random medical facts, and had one this week which had a bit about odd things found inside of people, including a live eel in someone's rectum which was eating on his colon, 40 pocket knives, Lego tire up a kid's nose for 3 years, a pea plant growing in a man's lungs, a candy cane in someone's rectum. There was a tiny bit of background with some of them, but I can't remember all the details. Not my story. My friend is a radiographer. A guy came into the hospital with Barbie dolls up his butt. After scans, one came out without too much issue, but the other was too far up. They were worried that if it was pulled out, its arms would open and puncture the bowel. So they scheduled